Hi, I'm Michelle Grazoulis, and I'm president of the Foundations at Rochester Regional Health, and I'm joined today by Dr. Marina Skrombolas, a dentist at Unity Dental in Penfield. Thanks for joining us.
Thank you for
Happy
having
to
me.
have you here. It's my first time talking about dental health. So, as always, I want to invite the audience to ask questions, so feel free to write them in, and we will take a break and make sure that we get your questions answered. So let's get started. It's my understanding that one of the first things that you did when you came to Rochester Regional Health and that you were involved with was the mobile medical unit. Can you tell us about that?
Yes, so the mobile medical unit is a program through HealthReach. It's grant funded, and it provides medical care, dental care, behavioral health, caseworker, insurance help for the homeless population in Rochester. So I was there for 3 years, and it was a very rewarding experience. Now I work at the Penfield office under Unity Dental. So Unity Dental has 4 locations. One is the mobile unit that moves around to the homeless shelters. The other is the Greece location downtown at St. Mary's, and obviously Penfield.
It's having seen firsthand what the mobile medical unit does, it's amazing. And I know that that work is incredibly moving. I mean, I think it's incredible. So thank you for what you did there.
Thank you.
And continue to do there. So what made you want to become a dentist?
Well, I've always been fascinated with dentistry ever since I was a little girl. I just really thought that it was awesome to help people in this way, and there's an artistic factor that I really enjoy, the fixing teeth part. And you know, in a day I can help somebody get out of pain. They come to me with pain and they leave without pain. I can help somebody be more confident with their smile. You know, a lot of people have dental anxiety, so helping somebody that has that type of phobia get through it and continue to come to their dental appointments is really rewarding as well.
That's great. That's great. So there are many different at-home methods for dental care that we're going to get into in just a minute. But can you give us some basics? How frequently should we be seeing our dentist?
So you should see your dentist every 6 months.
I
Twice.
do that. Just so
Good.
we
Yeah,
do
twice
that.
a year you should be getting your teeth cleaned.
Okay.
If your x-rays need to be updated, this allows your dentist to see if you have any new cavities, if you have any other dental disease, before it gets to the point where it's painful. That's
Yeah.
what we want to prevent. You know, brushing your teeth every day is super important.
How many times a day?
You should be brushing your teeth twice a day.
Okay.
You should brush after breakfast. You should brush before bed, whatever time that happens for you. But before you go to sleep, for even if it's night or whatever shift you work, you should be brushing your teeth. You should be flossing, and then you should be rinsing at least 30 seconds.
So how long, I've heard lots of things through my 50 years, but how long should we actually brush for when we brush our teeth?
So if you're not brushing for at least 2 minutes, 2 to 2.5 minutes, then you're not doing a good enough job. You have to get all the surfaces of your teeth, and you just aren't able to do that if you're not brushing that long.
And you said something before I want to go back to. So x-rays. Should we have x-rays on an annual basis? Is that generally the recommendation?
Generally, that's what we do. Every year, you would update your x-rays. So you would update things called bite wings, which are, you know, they're not as many x-rays, but every 3 years, you take a full series so that we
Okay.
can see everything that's going on, the teeth that are in your bone, make sure there's, like we said, no disease.
I think it's funny because I think people think x-rays for teeth. You don't really think about the fact that there is the bone structure and there's other things that you all are able to see that have nothing to do with really our teeth.
Yeah, I've had a lot of patients that don't realize that there's still tooth that you can't see. So when they look in the mirror and they see the tooth, they think that's it. They don't actually understand that there's a root that's in the bone that has a lot of impact on the health.
Potential issues. Okay, so we've covered, I just want to recap. So brush 2 to 3 times a day. Brush for at least 2 minutes when you brush. Dental visits every 6 months, ideally. And x-rays, and then big x-rays once every 3 years, right?
Yeah,
Okay.
typically.
Okay, so something I want to talk about, whitening kits. So many people, as you and I both know, are doing at-home whitening kits. What are your thoughts on those? And I guess I'm really curious also, are the results permanent?
So whitening, unfortunately, it's not permanent because as you go through your life, you continue to eat things and drink things that stain your teeth. So if you're going to do a whitening system and you don't have a lot of finances, one of the best things to do is whitening toothpaste. One that I found is really successful is Colgate Optic White. It comes in a bright red box tube, and people have had really good results with that. A little more invasive systems are crest whitening strips. Those work pretty well. If you want to see a big result, you can go to your dentist and they can make you fitted trays. So these trays you can use over and over again. You just need to purchase the whitening gel. So if your teeth end up getting whiter and you're very happy with them, and then after some time, 6 months to a year or longer, you want to whiten them again, you can just use those trays again.
I'm curious, what's the ingredient? You mentioned the Colgate toothpaste. What's the key ingredient that actually makes the whitening happen?
So each whitening system is a little different. There's a certain percentage of peroxide that is a bleaching peroxide that makes that effect. One thing that I wanted to mention was that if you are going to whiten your teeth, you need to know that it does increase your sensitivity.
Yeah.
So you'll be a lot more sensitive to cold drinks. So that's something to watch out for. And I always recommend, if you are very, very sensitive when you start your whitening treatments, you should skip a day. So you should give your teeth a break. And also, if you have fillings on your teeth, they don't whiten. So crowns and fillings are material that does not whiten. So if you have a front tooth that's a crown, or you have a front tooth that has a filling, your natural teeth will whiten, but those
That
other
won't.
materials will not. So you may be calling more notice to those areas that
Yeah.
are fillings or crowns, so just be careful.
Following up on that, do you have any recommendations for people who have sensitive teeth?
Who have
If you wanna
sensitive
do
teeth?
whitening?
Yeah, I would say you need to skip a day or skip a few days if you need to, in order to get your teeth back to feeling a little bit normal, and then whiten again. Otherwise, I would also brush with Sensodyne toothpaste
Yeah,
and
that's
use a
what I use.
fluoride rinse. So
Yeah.
I would say ACT is a really good rinse. It has added fluoride in it, and fluoride just really helps with sensitivity.
Is it true to say that the reason that the whitening sort of can increase sensitivity is because of the enamel that it's pulling? Is it pulling enamel off of your teeth?
No, it's not really pulling enamel off of your teeth. It's actually getting into the microscopic tubules of your tooth.
Okay.
So that's where the sensitivity comes from, and it's kind of opening that up. The fluoride does help shrink that back down.
Okay, got it. So on this same vein of whitening, what are your thoughts about this charcoal whitening that's sort of a fad right now?
So-
I know what you think because you told me before, but I think the audience is going to be interested in learning that.
So charcoal kits, there's really no evidence that dental products that have charcoal in them have any benefit to your teeth. I would recommend anybody that wants to use anything, whether it be whitening kits or charcoal kits or anything, there's different things out there like oil pulling. I would go to the website, the American Dental Association website, and just do a little bit of research and see, they have evidence-based research where they see what the results will be, what the benefits can be, what the risks can be, and that's always a good idea to just check that out before
Yeah.
you start anything.
That's great. That's great advice. So we talked a little bit about brands, but is there anything, you mentioned Colgate for whitening and then Sensodyne for sensitive. Is there anything in particular that your office typically recommends or suggests?
So it depends on what the patient's needs are. That's what leads my recommendations. So if you have sensitive teeth, then I would recommend a Sensodyne toothpaste. If you have high risk of cavities, I would recommend a rinse like ACT because it has fluoride and that helps protect your teeth from that increased risk. It really just depends on your need. The most important thing is that you use a toothpaste with fluoride in it because fluoride goes a long way in protecting your
Yeah.
teeth from cavities.
And this wasn't originally in the things I was thinking to talk to you about, but I'm curious too. Brushing needs to start brushing should start as soon as you can get your child comfortable brushing, but it's the permanent teeth, right? The baby teeth. Talk a little bit about that.
So when your child develops their first tooth and that erupts, that's a really good time to bring them to the dentist. Not because the dentist is going to be able to clean it or do anything like that, but if there's 2-year-olds around and they always fall on their face. So the worst thing is for you to have trauma to your child and there's nowhere to go and you don't know where to go and you don't have a pediatric dentist to go to. So as soon as they get that first tooth, it's a good idea to go to the dentist and just make that relationship so your child knows that this is where we go when we do things to our teeth and clean them and whatever. So a lot of people, there's a misconception. Your baby teeth are very, very important. So if a lot of them have cavities and you lose them too soon, then your baby teeth hold the place for your adult teeth. So if they're gone, then your adult teeth may get lost and they can't erupt properly.
Yeah.
So you may have crowding as an adult or things like that.
Interesting. I didn't even
Also,
know
if you
that.
have a lot of cavities on your baby teeth and your adult teeth start to erupt or grow into that space, you have to think the environment is just not healthy. So now your adult teeth are more susceptible to getting cavities as well. So brushing your teeth, I always recommend for parents to let their child try and brush their teeth. They're not going to do a good job. They never do. Even until about 8 or 9 years old, they still can't brush their teeth very well.
That's true.
So you have to get in there and you need to brush it for them as well, because they don't get far enough back to get
Yeah.
all their teeth. They don't get all of the surfaces. They just don't understand it. At 8 or 9 years old, they finally do understand the concept, maybe earlier, but they still wouldn't do a good job.
Well, it's also
So
the
you,
time to do it, right? It's slowing them down and getting them to think about it.
absolutely, yeah. Yeah,
That's
so you
great.
can make it more fun by getting them an electric toothbrush or something like that, but it's just, I don't know what it is about brushing teeth. Kids just don't want to do it.
No, I know. I remember that with my kids.
Can you
Phil,
tell our
question.
viewers what an enamel is, and like people don't understand what enamel is, and like can it wear away, can you regain it, can you just talk a little bit about that?
Sure, sure. So your tooth is made up of basically 3 layers. The first layer is your enamel, and it's the hardest layer. The second layer is your dentin, and it's the more yellow, that's where the yellow color of your teeth come from. So when you start to lose enamel, your teeth do start to look more yellow. And then the third layer is the nerve, and the nerve sits right in the center of the tooth. So the dentin is softer because it protects the nerve, and the enamel is hard because that's what you chew all of your food with. So what happens is it's really hard for cavities or bacteria to get through the enamel, but once it gets through the enamel to your second layer and it gets to the dentin, it spreads out much faster. So we want to stop it before getting to the dentin, sorry. But if it does, then you don't want it to get further. Once it gets to the nerve and the bacteria invades your nerve, that's when you get into the situation where you would need a root canal.
What about wisdom teeth? How will people know when they've gotten them, or can you ask a question for sure?
Yeah, so let's talk about wisdom teeth. So, when do people know, I mean, I know this from my kids, right, because they had them as well, but talk a little bit about when people become aware of wisdom teeth, and then what should you do if you believe that you have issues or you're in pain?
So wisdom teeth, they are the furthest back molars, so they're technically your third molars, and we call them wisdom teeth. And a lot of people
Where'd that name
don't.
come from?
I don't know. I have no idea.
Just generally interested.
But
Must make us smarter, right?
but a lot of patients and people don't have room in their mouth for their wisdom teeth. So what happens is their wisdom teeth will butt up right against their second molars, and cause damage to those molars, or they won't even be able to find their way out, and that can cause infection. It can cause plaque to get underneath your gums. So we evaluate that around age 13. You'll start
Okay.
to see buds in the x-rays, and the teeth haven't come out yet, but we'll be able to tell maybe if those teeth are going to come out, if there's going to be room. A lot of times there is no room, and a lot of times, like we said, people don't get far enough back to brush those teeth and take care of them, so they end up getting decay, and
Okay.
they're so far back that they're a lot more difficult to get out. So we try and start evaluating that around 13, and they don't tend to come out or grow out or erupt until 16, 17, even well into your 20s. You can start getting your third molars coming in.
And you might not get them at all, though, is what you said too.
Yeah, you might not
Yeah.
get them at all. They
Yeah.
could just be congenitally missing. They could just never have enough room to come out. And one of the biggest risks of leaving them impacted is getting a cyst to form around them.
Yeah.
So even if you keep them impacted and they don't bother you, that's fine, but you have to get them evaluated. Like we said, every 3 years, we would expose an x-ray so that we can make sure that, nothing really pathology-wise is going on.
So the good news is, right, what you're saying is if you're consistent in seeing the dentist and having the annual x-rays or the every 3-year x-rays, your dentist is going to know what's happening even before you might feel it or not.
Absolutely,
Yeah,
yeah.
okay.
Preventative care is very important, and the way that we do that is with updated x-rays.
Okay. So let's shift topics a little bit and talk about something other than brushing. So bad breath. What's your advice for people where does it come from, first of all? And what's your advice to people who might be struggling with that?
So bad breath can be caused by a few different things. One of the easiest things to do to help fight bad breath is just brush your tongue. So your tongue can collect plaque and debris, and that sits there and you don't realize it, but it's actually causing bad breath. So by just gently brushing the top of your tongue to get rid of that plaque, that really helps go a long way with preventing bad breath. Another thing that causes bad breath is some systemic diseases will cause bad breath. So if you have acid reflux or GERD or things like that, that's really something that you can't control because that's going to be continuous. If you take medication, that can help control it, so you can see your doctor about that. But also in addition, to having excellent hygiene, you can rinse with Listerine throughout the day, and you can chew sugar-free gum, and that'll really help people who have bad breath because of, the systemic diagnosis.
Things that have really nothing to do with.
Another thing that causes bad breath is tonsil stones. So people who have really large tonsils, they collect plaque on their tonsils and they turn to hard stones and they smell really bad. So a lot of kids that have really large tonsils, their parents will tell me their breath smells so bad, and it's because that plaque is collecting on their tonsils. So you can get them evaluated by an ENT, ear, nose, and throat doctor, and see if maybe getting them out is a good option.
So I want to ask you a question about that because you just made me think of it. So different than wisdom teeth, tonsils. Talk for a moment about tonsils, what they are, and because that's an ENT space, right? Not a dentist space.
Yeah, I mean, it's a space that we evaluate as dentists, but it's not something that I can surgically or do anything as far as treatment-wise. But when I do evaluate, whenever somebody comes in for a new patient exam, we evaluate their whole head and neck. So we look for oral cancer, we screen, the areas of the tongue that are more high risk to get cancer. We evaluate your breathing space, which is where your tonsils come in. So if your tonsils are very large, it minimizes the space, your airway space. So with kids, this is particularly important because if they're not being able to breathe well at night and they can't sleep, then they're not getting enough rest, and that can lead to increased mood, decreased paying attention at school. So that's one of the things that I really pay attention to in children. In adults, when I see really large tonsils, they never seem to really be bothersome to them.
Yeah.
With kids, it's always, do you get strep throat more often? Do you find that they're sick more often? So that is one of the areas that we do evaluate.
Thank you very much. That's helpful. So I'm sure that there's things that all of us do on a daily basis that we probably don't realize are not good for our teeth and harmful to our dental health, but talk a little bit about what they are. Like, I know chewing ice is a big one.
Oh yeah, so chewing ice is habits like chewing ice or habits like parafunctional habits like chewing on your pencil. Those are really bad for your teeth because they cause little microfractures in your teeth, which makes it easier for bacteria to get in and cause decay. So it's easy to say you need to stop doing those habits, but it's not very easy to do. Smoking is a terrible habit for your teeth and your body systemically, but it's easy to say stop, but it's hard to do. Another thing that I notice is my patients can follow my oral hygiene instructions perfectly. They'll brush their teeth twice a day, they'll floss, they'll rinse, and they still get cavities. And that's because brushing your teeth isn't the only thing that decreases your risk of getting cavities. Your diet has a big effect on it, and the medications that you take has a big effect on it as well. So if you drink coffee all day long or you drink soda all day long, you have to think your teeth are constantly being assaulted by acid and sugar, and they never have a break. So it increases your risk of getting cavities. So what I recommend is just alter your diet a little bit. Try and drink your coffee within the hour, or alternate with water. If you're going to drink soda, drink the soda with your meal, and then the rest of the day don't constantly assault your teeth with these attacking things that'll cause cavities. So, and as far as medications, it's a little bit more difficult because you can't stop taking your medications. But if your medicine causes dry mouth, that's a big thing because you don't have saliva to naturally cleanse your teeth. So that decreased production of saliva actually increases your risk for getting cavities. So one of the things we do is we offer Biotin Rinses for people that have that issue, drinking water throughout the day, and then we ask them to increase brushing. So brush after every meal, because if you leave the plaque sitting around on your teeth and there's no saliva to flush it out, you're more likely to get a cavity. So just brush your teeth and get rid of it, proactively, I guess.
That's helpful. Thank you. So let me just check with Phil before we wrap things up and see if there's any other questions. We're good. Okay, so first of all, I want to go back to something you said in the beginning, which is talk about the locations, because I want to make sure people know after watching this how to get in touch with you or anyone on the dental team at Rochester Regional Health or Unity. So tell us again about the locations.
So we have a location in Penfield, location in Greece, and a location downtown at St. Mary's Hospital, and all of them are accepting patients at this time.
Great. So if you are interested in seeing Dr. Skrombolas or to schedule an appointment with anyone on our dental team, visit www.rochesterregional.org, And I want to thank you for joining me today.
Thank
This
you
was
for
really
having
helpful
me.
information, and I know that there's lots of questions out there that people have, and this really helps get answers to the most basic things that we forget to ask. But if you had a question that you didn't send in, please feel free to send it in, and we'll make sure we try to get back to you. So Dr. Skrombolas, thank you very much.
Thank you.
Great having you. Have a great day, and we'll see you soon. Nice job.